Compassion fatigue is a state in which empathic energy is depleted in somebody in a caregiving role. We often see compassion fatigue in people who are healthcare professionals working with acute care patients as well as people in palliative care. We're also seeing an increase in compassion fatigue in those who are in our community taking care of ill or dying loved ones, especially if that loved one is living with them. Long-term effects of compassion fatigue include impaired health, impaired mental health, a decreased ability to work on a team, as well as a decrease in overall well-being. We are also seeing that compassion fatigue negatively impacts the quality of care that our vulnerable patients are receiving. Our study was a mixed method study that included both quantitative data from pre and post tests, as well as qualitative data from focus groups conducted at the beginning, the middle, and the end of the session. Participants were recruited from the multidisciplinary team at the Windsor Regional Hospital Cancer Center. Our participants went through 6 sessions of a formalized compassion fatigue resiliency program, and they went over information such as what compassion fatigue is, signs and symptoms, ways to modify your lifestyle in order to prevent it, as well as coping mechanisms. We found that our participants reported an overall decrease in stress related to the clinical setting at the end of the 6 weeks. Our participants also stated that working as a team throughout the program improved team cohesiveness when working on the floor. Many participants reported that the breathing techniques and mindful meditation they went through were helpful in decreasing stress both on and off the floor. Many participants suggested that this session be condensed into a weekend-long program and be open to staff and all the units of the hospital in order to make the information more accessible to those who need it. This project was intended to increase the body of knowledge we have regarding compassion fatigue. More research is necessary in order to determine the best way to move forward in order to treat compassion fatigue in both our healthcare professionals as well as the members of our community.